Hi, my name is Dr. Arnold, and I'm going to be doing some FAQs, frequently asked questions about Invisalign. So Invisalign is simply a system that I've chosen to use to move my patients' teeth when I'm straightening them. So what Invisalign boils down to are these aligners, which are clear plastic trays that you change every 7 days. And because they're clear, it means that people don't actually see from a distance that you've got a brace on. How they actually fit, they fit snugly onto your teeth and very transparent, so as discreet as we can get it when we're moving your teeth and straightening them. So the types of cases that Invisalign can treat are, there's a wide variety of cases, whether you've got teeth bunched up towards the front, maybe you've got spaces, maybe your teeth don't meet properly, maybe you've got a gap between your front teeth. Invisalign can approach all of these different issues and treat these issues. The extent to which you can treat them, you'll need your dentist to have a look. So I can take a look and see whether Invisalign would be the right fit for your situation. So many different situations where Invisalign is a good fit. So the difference between Invisalign aligners and the traditional type of metal braces, first of all, is the fact that Invisalign aligners are clear, transparent, they're comfortable, they're removable, and they fit much more with people's lifestyles. Whereas with the metal braces, it conjures up those pictures of the train tracks on your teeth. They're gray, they're metal. It can be a bit tricky to really clean in and around the metal braces, but they still do have a role that they play. But the main difference, I would say, is how discreet Invisalign is and how it fits with people's lifestyles. Sometimes people come and see me and they've had fillings, maybe crowns, different types of dental treatment that they've had carried out before. That doesn't discount you from getting Invisalign as a treatment to straighten your teeth and have your smile makeover. What's important is the fact that we really have a look at how things are in your mouth, and we plan a way for Invisalign to work with how your teeth currently are with the fillings or the crowns that you currently have. So it's all about the plan and how that plan works in your situation to then bring you to the result that we want. Invisalign can be used to treat children, it can be used to treat adults, it can be used to treat the elderly. There's no hard and fast rule about what age is a cutoff for using Invisalign. Maybe babies, we can't use it on babies. But for adult teeth, personally, myself, I will use it to treat children who've got their adult teeth, and adults, of course, who have their adult teeth. Whereas children who still have baby teeth, then it's likely that they need a different system of Invisalign to treat. So with myself, as long as there's adult teeth and no baby teeth, then it's likely that I can use Invisalign to treat. But if I find that you do have quite a few baby teeth, then what I will do is I'll refer to somebody who can use Invisalign for your case. Invisalign can work very well in people's lifestyles. Because they're discreet, it means that you're not conscious that people are seeing metal braces when you smile. And that's one of the main reasons why people come to me, because they want to have a confident smile. So putting metal braces can be the thing that puts them off from getting the smile that they really want. So the fact that Invisalign is discreet, that works well for the lifestyle of many of my patients. The fact that they're removable, it means that cleaning your teeth and maintaining your oral health is very straightforward. And the fact that they're made from the scan I take of your teeth, it means that they're much more comfortable than the traditional metal braces. When you're wearing your Invisalign aligners, one of the things I go through is how you'll maintain them during the treatment. So having food, you can't have food with your aligners in because that will distort them and they're not going to work as effectively as they can. Having drinks, you can have cold drinks with the Invisalign aligners, but hot drinks will deform the Invisalign aligners. So you can't have hot drinks with the Invisalign aligners. The question I get asked very frequently is how long the treatment will take. Until I've collected some records, I've collected your x-rays, your photos, and your scan, it's impossible for me to tell you how long your Invisalign treatment would take. What I can say though is the majority of my patients usually finish treatment between 6 to 9 months. In some cases it's shorter than that, in some cases it's even longer than that, but the majority seems to be between 6 to 9 months. One concern that patients sometimes have is whether they'll have a lisp from wearing the aligners. In the majority of cases, people can get through the treatment without getting much of a lisp. Sometimes people will have a lisp in the first few days, maybe the first 2 weeks, and then they get used to talking with the aligners in. Most people, once I put the aligners in, they talk perfectly fine, perfectly normal from the start. It's only a very small minority of patients where they might have a lisp that persists, but that's in the minority. In most cases where I'm using Invisalign to transform smiles, that's just part of the smile journey. So it may be that we're going to whiten the teeth and then shape the teeth afterwards with something like composite bonding or maybe veneers to give that smile that my patients are looking for. It may be that it's simply just whitening the teeth afterwards to give the smile that my patients are looking for. So in most cases, it's straightening with Invisalign, then whitening, then we think about your retainers. Retainers are the most important part of this whole process because there's no point getting straighter teeth if we're going to lose all the progress we've made and the teeth move out of position again. So retainers are a big thing, and I make sure that I make you 3 sets of retainers, 3 copies. That way, if you lose one set, you've got 2 other sets. If you break one set, you've got 2 other sets. So you've always got backups. So I make you a set of retainers, 3 sets. And then I see you as well for aftercare appointments because I want to make sure that the result is stable and it's going to last you. So I see you at 6 months after treatment and I see you at 12 months after treatment, just to make sure that we're both happy that you've got a good result that's maintained and stable. And if we have a good year of stability, we can both be confident that you'll be absolutely fine and smiling confidently for a long time. So there are different options when it comes to retainers. I make removable retainers by using the scanner to scan your teeth when they're straight, and they're the Invisalign made retainers. So I make you the 3 sets of those retainers, but you can also get fixed retainers or what are called bonded retainers. This is where we put a thin piece of wire at the back of your teeth, and that secures your teeth even more in place. So in some cases where people are at higher risk of their teeth moving out of position, I will provide you the removable retainers and I will provide you with the bonded retainer as well. Another big question is whether the Invisalign process is painful. What I can say is, if you know somebody that's had the traditional metal braces, or if you've had traditional metal braces before, maybe you found that very uncomfortable. What I can say is Invisalign is much more comfortable than that process. There is an ache that you will feel when your teeth are being moved. And that's normal. That's something that we expect, because your teeth have been in one position for a long time and now they're being moved. So there is an ache, almost like a muscle ache, but just with your teeth. What happens is, after the first few weeks of wearing the aligners, you get used to that sensation. And I haven't had a case yet where someone has said, this is so painful, I can't go on. People really get used to the process very quickly, adjust to it. So I find that it's very manageable for my patients, whether it's adult patients I've treated with Invisalign, or whether it's child patients, teenagers who I've treated with Invisalign. Once you've decided that you want to inquire a bit more about Invisalign with myself, the first thing is to fill in the smile form. On this smile form, you'll be able to write down exactly what it is that's bothering you, what you want to improve about your smile. You will also get to take some photos of your teeth just to give me a better idea about what your smile currently looks like. And that way I can give you much more information when we move to the next step, which is the video consultation. So at the video consultation, we get to speak virtually from the comfort of your own home, and I get to answer some of your questions. I get to talk to you about the process in depth, and I get to show you how real patients have been treated at the clinic at Penwortham Dental. Once you're happy with the discussion and the information that you've received, we then move over to bringing you into the clinic. We take some records, x-rays, photos, a scan, and then I put that all together to make a bespoke plan for your Invisalign treatment, for your smile transformation. I'll then send you a video report going through all those details that you need to know. And once you're happy, we'll get you booked in for your first Invisalign Fit appointment. So you will come in, we'll fit your first set of aligners. I'll go through what you need to be doing, and then I'll be seeing you every 4 to 8 weeks just to monitor how you're progressing with the treatment. I usually do 2 rounds of the treatment. So we'll go through your first round, which might be some months, and then your second round, which might be a few more months to get to the end of treatment. And once we've got the teeth in the position we want them in, we then whiten the teeth. We then make you your retainers, your bonded retainers if needed, your removable retainers. And then I see you for aftercare appointments, because it's important that your result lasts you for a long time. So I see you twice in the space of a year for aftercare appointments to make sure that you're still smiling a year after I've finished treating you. In the video consultation that we have, that is important because it allows me to really understand what main issue you have. Is it the fact that you've got overcrowding? Is it the fact that you want your teeth to be whiter? You want a certain type of smile? I want to know exactly what it is that you want from the treatment. So you'll get to ask me some questions. I'll then get to answer those questions. And what I do for people is I go through a presentation of pictures. Don't worry, it's not a lecture. It's short 6-7 minute presentation where I show you pictures of patients who have had treatment with myself and how they progressed with that treatment. So you get to see how Invisalign actually works for real people that I've treated. So we go into that, and you get to see what the retainers look like in the photos. You get to see what the bonded retainers look like and the removable retainers. So I go through all of that with you. The smile assessment form is a key part of your Invisalign process. It gives me the information that I need to start giving you and providing you with the information you're going to want to know. So on the smile form, you get to fill in what you would like to improve about your smile. You get to take some photographs that allow me to see what your teeth are like, how your teeth bite together, and how your teeth are looking at the moment. And that way I can start to give you options that may be suitable for you. So the smile assessment form, very important part before we move on to the video consultation. You've come in to the clinic and you're going to have your Invisalign scan. Some photographs will be taken, x-rays will be taken, and the scan is going to be taken. So the scan allows us to get a 3D representation of your mouth, how your teeth are, how your gums are, and how your teeth meet together when they're biting. So the scan is a vital part of the whole process. It's using that scan that we can make your Invisalign aligners. So that scan is what your aligners are going to be made from, and it ensures that you get a great fit for your Invisalign aligners. The number of visits that you're going to have is going to vary from person to person because people are not robots, people are different, and the aims that we've got for treatment are going to be different from person to person. So the time that it's going to take for you is going to be different to the next person. What I can say is that for most of my patients, treatment varies from 6 to 9 months in the majority of cases. I will get some cases where they finish much sooner than that, and in some cases that are more severe, it'll be much longer than that. It can be even up to a year in some cases. But this is why I need to have a look at the records, the photos, the scan, as well as the x-rays, put together your plan. It's when I put together that plan that I can then let you know the approximate time for your treatment. Your first visit to the clinic will be to get the scan taken, the Invisalign scan, the x-rays, the photos. Once we've got that, we put that together to design your plan. Your next visit into the clinic may be to then sign off some consent forms and to sort out how you want to pay for the treatment. The next time you come to the clinic may then be to start your Invisalign journey, so to get your first aligners fit. What I'll do is I'll prepare your teeth, I'll go through the instructions for wearing your aligners, and you'll be ready to go. That first appointment where we fit your aligners, that's going to be the longest appointment that you have because we need to prepare your teeth. So I usually say leave an hour for that appointment. Not that you'll be in the chair being worked on for an hour, but it allows me to prepare your teeth as well as talk you through what you need to be doing at home with enough time to do it comfortably at a good pace. I will then see you every 4 to 8 weeks to make sure that your teeth are tracking along nicely, that your teeth are moving as predicted. If I need to make any changes or alterations, I can do so in those follow-up appointments until we get to the point where you've gone through your first round of treatment. So it might be that you had 18 sets of aligners to go through, so 18 weeks. At week 18, I will then look at where your teeth are, and I will likely do a second round of alignment. So I want to make sure that we get you as good a result as we can. So we'll scan you again at the end of that 18th week. We'll take some photos, I'll make a new plan, and we'll make your result as good as it can be. That second round could take maybe 10, maybe 15 weeks. Once we finish that second round and we're happy with where your teeth are, we would then start the whitening process, whitening your teeth, and then we'll look to make you your retainers so that your teeth can remain straight. We'll then see you for aftercare appointments twice within a year to make sure that your result has remained stable. And that would be the end of everything, and we can be confident that you'll be smiling for a long time.